I'm a sport and exercise medicine physician and Professor of Sports Medicine at La Trobe University in Melbourne. I've been working with athletes of all sizes, shapes and abilities for 40 years, working with AFL clubs, Australian Olympic teams, the Socceroos and the Aussie cricket team, as well as a stint in the UK as Head of Sports Medicine at Liverpool Football Club. Tough gigs, but someone had to do it. So why am I here talking to you about diabetes? My father had type 2 diabetes, and I watched as he progressively suffered many of the typical complications. I was determined not to go down the same path. A few years ago, despite eating a so-called healthy, low-fat diet and exercising regularly, I was significantly overweight with high triglyceride and insulin levels, as well as suffering from a fatty liver. In other words, I was pre-diabetic. I decided to try a low-carb diet, reducing my intake of sugar and starches. After 3 months, the results were incredible. I reversed all my metabolic abnormalities, as well as losing 13 kilograms. I've maintained that way of eating ever since. Every blood test comes back absolutely normal, and I have no doubt that if I had not made those changes by now, I would have type 2 diabetes. As a result of my own experience and years of intense study of the relationship between diet and metabolic disease, I'm now passionate about the real food way of eating that focuses on healthy proteins and fats while limiting sugars and processed foods. Type 2 diabetes is a disease of carbohydrate intolerance. So it makes sense to control your diabetes by limiting your carbohydrate intake. That includes limiting not only sugars, but also starches, which are broken down to sugar in your body.
Hey everyone, my name's Laura Simmons and I'm the CEO and founder of Theratrak. I'm also a paediatric occupational therapist. Theratrak is a digital solution that enables any allied health professional to create, monitor and track custom therapy programs for their clients. Theratrak is an asynchronous telehealth platform that provides therapists with a convenient and efficient virtual healthcare solution, empowering clients to take charge of their health and reducing backsliding between appointments. Our primary customers are therapists that work in the mental health, chronic disease and disability space. Theratrak is a tool that seamlessly fits into a therapy session, allowing the therapist to capture and digitize meaningful information from that therapy session and then send personalized reminders to their clients, empowering their clients to be as independent as possible with their therapy strategies outside of the session. For therapists, they have easy access to real-time feedback about their treatment strategies, enabling them to quickly and easily make the most informed decisions about their treatment going forward and saving them critical time. I'm super excited to be selected as one of the finalists for the Innovate Health Pitch competition. I'm really looking forward to connecting with all the other finalists and delegates at the conference, learning about their businesses and how innovation will drive the digital transformation of healthcare here in Australia. See you there.
Hi everyone, my name is Hitesh Mehta. I'm co-founder and co-CEO at Nutromics. Prior to Nutromics, I have over 10 years of experience consulting in the healthcare industry, most recently as part of IBM Watson Health. As part of this, I've had the unique opportunity to work on implementing new models of care and service delivery in healthcare systems across the globe. It was this passion for healthcare and change in healthcare that led to Nutromics, which I helped co-found with my co-founder Peter Brains. At Nutromics, we have a vision for a world with zero preventable death due to lack of timely molecular data. Currently, clinicians are often having to make dosing decisions in critical and fast-moving diseases without having the right information, the right data in front of them. A prime example of this is the life-saving antibiotic vancomycin, where 60% of doses are not in the right therapeutic window. This often results in patients getting either a toxic or ineffective dose of a life-saving antibiotic. Our wearable lab-on-the-skin solution is designed to give clinicians access to accurate and continuous monitoring of vancomycin concentration levels in real time, allowing them to make timely and informed clinical decisions for their patients. We believe this will help save thousands, if not millions of lives globally. I'm really looking forward to seeing everyone at the conference later this year. After almost 18 months of virtual conferences, it'll be great to connect and meet with other innovators and disruptors in the healthcare industry in Australia.
Hi, I'm Dr. Louise Metcalf. I'm the founder and CEO of Gheorg, the little virtual robot who helps kids to manage anxiety and to build resilience. Gheorg is now being used all around the world, including in places like Myanmar. We get to help kids in really difficult circumstances. I'm really looking forward to this program, particularly because of the great speakers, but also because I get to talk to people who also be really keen to help solve mental illness in children and also to help solve self-harm and suicide in childhood.
Hi, I'm Dr. Evelyn Chan, CEO and co-founder of Smileyscope. Smileyscope is reimagining healthcare through virtual reality. As a paediatric doctor, I wanted a tool that I could help use and support to educate my patients during anxiety-provoking procedures or to help alleviate pain, improving the moments that matter the most. I'm looking forward to the Innovate Health event with clinicians and leaders in startup, industry, investment and research being able to exchange ideas and strengthen the community that is passionate about improving healthcare.
My name is Vikram and I'm the founder of ConsultMed. The idea behind ConsultMed comes from my own experiences working as a paediatrician. So for many of my patients, accessing specialist care can be quite a time-consuming and inefficient process. So first you need to go and see your GP. The GP may handwrite the referral and then send it via fax to the hospital or specialist clinic. The referral itself is usually just a piece of paper and is often missing useful clinical information, resulting in us ordering unnecessary and repeat investigations. Our research shows that it takes on average 6 to 8 weeks for an appointment to be first made after a referral first enters the public hospital system. And this can really affect patients receiving timely and appropriate care. So in response to this, my team and I have developed an integrated and secure referral platform called ConsultMed that directly connects GPs to specialists. So our service allows GPs to send referrals and other health correspondence electronically, and in turn specialists are able to use the platform to triage, provide advice and guidance, and book appointments on the spot. Every stage of the referral is tracked, so both patients and healthcare providers are kept in the loop. Where we add value is we take away the uncertainty and the complexity and the paper out of sending and receiving referrals. So unlike our competitors, which primarily is the fax machine, our platform is secure and data protected. It meets the stringent Australian digital health, security and privacy standards. It allows two-way communication, it's patient-facing, and every stage of the referral is tracked. What perhaps started off as wishful thinking on my part to try and improve health service delivery has now come a long way. We have assembled the right team of senior clinicians, software engineers and designers, and are backed by industry experts. For me, ConsultMed is an opportunity to use our skills, our networks and our experience to make a real impact on the way that patients access reliable and timely healthcare. One silver lining of the COVID-19 pandemic has been this move to digital healthcare, and our service supports the use of digital health technology to provide alternative models of care and to support whole of population telehealth services. During lockdown, for instance, I was fortunate because I could do telehealth from home to look after my patients. But to give you an example of how ridiculous the system is, I actually had to drive into hospital once a week to pick up my faxed referrals.
CareMonitor is a cloud-based shared care, remote patient monitoring, and telehealth platform. The key thing CareMonitor solves is reducing the friction in terms of access to healthcare. If you think about the patient journey for someone with a complex or chronic condition, they could have multiple touch points. So you go to the GP, the specialist, allied health, hospital, and they're probably all using different systems. And the experience for both the patients and the providers is fragmented. And you have silos of information sitting across different places. But that's something which CareMonitor solves by providing this cloud-based solution which is connected to different health systems and making that journey for both the patient and the provider seamless. Through the patient mobile app, the patient is able to see the entire care team. So it's the extended care team that they have, not just the usual practitioner, but the other providers who are also interacting with them and it feels as if it's a virtual care team. I'm looking forward to the Innovate Health 2021 conference, which is about accelerating the growth, uptake, and commercialization of digital health innovations across the health industry in Australia. For 2021, the spotlight is on remote monitoring and digital innovations enabling home as the center of care. Come and join us at the Innovate Health Pitchfest 2021.
Hi, my name's Luke. I'm the founder and CEO of VaxApp, an immunisation management platform that enables providers to vaccinate more people in less time with less cost. We've developed the world's first immunisation eligibility engine. This automates the suggestion of what vaccines a client may have and when they can have them. The eligibility engine, combined with our automation features and also the very latest integrations with the Australian Immunisation Register, has enabled us to reduce the vaccination processing time for our clients by over 50%. Now, I cannot wait to hit the stage at Innovate Health's Pitchfest alongside some absolutely incredible startups. Innovate Health is a brilliant opportunity for leaders in the digital health industry to come together and connect. I can't wait to meet you there.